और इसके दो बहुत विशिष्ट कारण हैं। तो पहला विशिष्ट कारण ये है कि हम लोगों के पास एक निश्चित समय अवधि में एक्शन लेने की ज़रूरत है। मैं सबसे पहले धन्यवाद दूंगा डॉक्टर जोबन मोढ़ा का कि जिन्होंने इस इम्पॉर्टेंट इशू को हमारे एक व्हाट्सएप ग्रुप है क्वालिटी सेफ्टी इफिकेसी ऑफ आयुर्वेदिक मेडिसिन, इसमें वो ले आए। ये नोटिफिकेशन जो है नेशनल फार्मेसी कमीशन बिल 2023 के नाम से प्रकाशित हुआ है और ये 10 नवंबर 2023 को इट हैज़ बीन नोटिफाइड एंड इट इज़ इन द पब्लिक डोमेन फॉर द कमेंट for the all stakeholders, and the aim of this national pharmacy commission bill, national pharmacy commission bill, yes, national pharmacy commission bill 2023, which will repeal pharmacy act 1948, and this has been notified on the 10th November 2023. Means any stakeholders may comment to the government on this up to the 9th December 2023, and Poonam Meera is the person, Deputy Secretary to the Government of India, under whom signature it has been notified. So here, since morning when it is in the group, many people, specifically I am very much thankful to the Dr. V. Ravishankar. He is just very pioneer in the field of initiation of the establishment of the course of the B Pharma Ayurved, M Pharma Ayurved at Gujarat, the then Gujarat Ayurved University, Jamnagar, IPGTR, now ITRA, Jamnagar. So, under the leadership of Professor, under the vision and the mission of the Professor P.N.V. Karup, the then Vice Chancellor, we worked out all that. Specifically, main stakeholder was the Dr. B. Ravishankar and many others also there. So, there was initiation of a bill, the Indian Pharmacy Council Bill 2003, and it was discussed, it was tabled into the Rajya Sabha, but opposed by the Pharmacy Council of India at that time, if my memory is with me, and then it was referred to the Privileged Committee of the Rajya Sabha, and till date it is there only. I don't know what is the rule of the Rajya Sabha Secretariat for these 20-year-old bills, whether they are standing or they are now cancelled, treated to be cancelled, I don't know. I have no information about that, but it is there. So here Professor Asmita also commented, and Dr. Joban has given a screenshot that where is some reference of the Ayush system, and I don't want to read all that, but okay, I shall read because yes, because just the main message is very clear, and that is the very in simple terminology. Yes, he has screenshot has given that the clause here it is, the commission shall hold regular meeting with its national and state counterparts responsible for regulating medical, dental, nursing, allied healthcare and Ayush education at such time and place of the mutually decide to enhance the interface between different workforce categories in modern and traditional system of the medicine, develop consensus on issues and promote team-based approach to healthcare delivery. Yes, good. Here this draft bill is giving you opportunity to interface, and this 61-page draft I have not studied detail, and I request all of you who are listening that all the stakeholders must go through this and see whether what are the provisions, whether the Ayurvedic Indian Pharmacy Council bill is it is not there, so there is no question of the recognition, but how they are treating the Ayurveda education, I doubt that they are having a strong note in this draft about our courses of the B Pharma Ayurveda and the M Pharma Ayurveda and its legal recognition. But here is the good thing that they have opportunity to for the interface only. I doubt about the legality. and or the control on the education. The PCI wanted to control the whole B Pharma Ayurveda and M Pharma Ayurveda education under their domain, and the then Vice Chancellor Professor P.M.V. Karup sir opposed it very boldly. No, we have our own pharmacy council, and certainly it's the right step, because if NCISM is there to regulate our education system on the line of NMC, then if it is the National Pharmacy Commission Bill 2023, so there may be the National Indian Pharmacy Commission Bill 2023 or 2024, 25, whatsoever the time. The Indian System of Medicine, National Indian System of Medicine Pharmacy Commission Bill, what I dream. And it was there into the 2003. But due to certain pressures of the allopathic giants or the biomedicine giant or the manufacturing, they wanted to trap it, to check it. They wrote, their registrar PCI, Secretary PCI wrote over Registrar Gujarat Ayurveda University officially to check this commencement of the course, to stop the studies of the B Pharma Ayurveda and the Pharma Ayurveda. All the documents must be in the university documents that there in Jamnagar. So here is the need of strong action, need of to go through the 61 pages of this draft and comment, and we have time just 20 days in our hand, because 9th December is the 2023, the last date to comment on this. So be aware and take initial actions, and make a consensus among us. We may discuss it on any platform, any Zoom meeting or anything. Dr. Joban Moda, you may organize, and or anyone can organize, and but it must be. But before one should go to the all 61 pages. I have not gone. I shall go. Certainly I shall go. But you all must go. I must go too. And then within 3-4 days we make a point to discuss this, and what is our legal status in this National Pharmacy Commission Bill. When I say we, I mean the graduates and the postgraduates of the B Pharma Ayurveda and the M Pharma Ayurveda. That is my concern. That is my point here. So here is the need of an alertness, a discussion, and if things are going wrong against us, then representation to the, in this regard, to the Ministry of Health, quoting this National Pharmacy Commission Bill 2023. If it is good, then also the appreciation. We do both as per the clauses there in. Fine. Okay, thank you. Then the second issue is really very good, and that is about the clarification issued by the Ministry of Ayush about the prefix and the suffix of the names of the classical Ayurvedic medicines and the excipients permitted for the 3H drug, patent and the proprietary drugs. And for this I thank Mr. Abhyuday Sharma from the Jaipur, and MD of the Navjeevan, and Dr. Himanshu Shekhar Tiwari, who is also very much moving in the Ayurvedic pharmaceutics. They both put these notifications to our group, WhatsApp group of the QSC, and really it is very much exciting, and I am happy to see it, this notification. This was 20-year-old conflict, but now it is very clear, and it's I'm not going in the details of the conflict, what we witnessed at that time, 2004, 2005, and all the expert panel of the Ministry of Ayush and the industry was not on the same board. There was a difference of the opinion, there was a conflict of interest, there was a doubt about the intentions of the industry, why they want Triflachun and Prefix or the Suffix, the name of the company, or some fancy names with the classical names. So it was discussed, and the government allowed, no, we will not allow Pachan Triflachun. Triflachun is there, then what is the need of the Pachan? Yeah, Basant Kusmakar Ras, Dabo, like that. So no change into the classical name, and the company was the of opinion why we should produce and how we can promote, that is it's our having some special quality. Then they wanted to note it Dabur Triphala Churn, Vaidnath Triphala Churn, Dhut Papeswar Triphala Churn, Ayurvedisala Triphala Churn, Sandu Triphala Churn, Charak Triphala Churn, and many more, Nagarjun Triphala Churn. That was also not agreed upon. So some manufacturers got notice as per this notification of the signed by the Arjun Kumar, Under Secretary to the Government of India. So here it has been very clearly clarified that they should not be given any notice on the basis of only that the manufacturer name is on the label. श्रीमान जी आपका ही कहता है रूल 161 सब क्लॉज 3 सब क्लॉज 3 दैट देयर मस्ट बी नेम ऑफ द मैन्युफैक्चरर ऑन द लेबल. तो ये तो होना ही है. हाँ, अब नाम कहाँ होना है ये बात है. तो इट शुड नॉट बी एज ए प्रीफिक्स, it should be somewhere at the level of the corner mark manufacturer. This, so that's good clarification. And about the permitted excipients also, I agreed with this, the rule 169. Okay, so rule 169 is giving the list of the and that is also just a reference, and some list is somewhere else. Hold the list of the permitted as per this, as per this. So here the point that no company should be notified that you have not giving all the details of the additive. But when they got notices, they represented to the ministry, and ministry has clarified it. You only the preservatives and the coloring agents should be there on the label. See, the three things are here. Yes, in fact, three things are here. Rule 1571B, Rule 169, and of course rule 61. And rule 161, it's subclause 3 specifically, clause 3 specifically, and then from subclause 1 to the 9th till the percentage of the alcohol. If you go through all that, there is from in the rule 161 clause 3 subclause 1 to 9th, it is not mandatory to give the names of the additive there. There is a lot number, batch number, manufacturing license number, manufacturing date, external use only, the name of the manufacturer, Ayurvedic Siddha medicine, ingredients, the plant origin, botanical origin, all these things are there. Not about anything about the additives. So here in this clarification, that should be kept in the mind. And appreciating the Ministry of Ayush, thanking Ministry of Ayush, here I have two humble submissions. Certainly I am not criticizing, I am appreciating, but डर लगता है ना आजकल किसी को कुछ कहो तो उसको शिकायत समझ लेता है. ऐसी कोई मेरी मनसा नहीं है, कोई शिकायत मुझे नहीं करना है. आप ओवरलोडेड हैं, मुझे मालूम है. आप जब भी मिनिस्ट्री की विजिट होती है हम देखते हैं कि सारे लोग बस फाइलों में घुसे हुए हैं, काम ही कर रहे हैं. तो देखिए आपके इस नोटिफिकेशन में जो मिनिस्ट्री का आया है वहाँ पर पहले पैराग्राफ में भी लिखा हुआ है, चलिए पढ़ ही देता हूँ कि एज यू आर अवेयर दैट द प्रोविजंस रिलेटेड टू यूज ऑफ प्रीफिक्स सफिक्स विद द नेम ऑफ द आयुर्वेदिक सिद्धा यूनानी ड्रग्स एंड द परमिटेड एक्सिपिएंट फॉर इशू ड्रग्स आर प्रिस्क्राइब्ड अंडर रूल 1571B एंड द रूल 169 ऑफ द ड्रग एंड कॉस्मेटिक रूल्स 1945 रेस्पेक्टिवली. देखिए आज की तारीख में द ड्रग एंड कॉस्मेटिक रूल्स 1945 डज नॉट एग्जिस्ट. Everywhere, even in the notifications of the CDSCO, even in the notifications of the Ministry of Health, even in the notification of all the books, the word is being used, the drug rules 1945. It is the drug rules 1945 since 2020 because cosmetic rules 2020 is now in a separate framework. As we have going to have the National Pharmacy Commission Bill 2023, in the same way they have separated this drugs and cosmetic rule 1945 in two parts. One is the drug rule 1945 and another one is the cosmetics rule 2020. So in this notification at least at three places I have not counted, the drug and cosmetic rules 1945 is quoted. Kindly in the further notices of the Ministry of Ayush, use the word the drug rules 1945. You can check it everywhere, the CDSU or the all others. The drug rule 1945 is in the practice, not the drug and cosmetic rules 1945 is in the practice. So here the alertness is requested from the Ministry of Ayush. And in the same way here, in this notification, the important, if we are talking about the labeling, then certainly there must be a reference in the change of the language of the rule 161 along with the rule 571B and the rule, not the I'm talking about the, yes, the rule 169, that is also on the basis of the labeling. So here one thing is just one connection is missing, and that connection is, that is the compulsory, that is the rule 161 clause in totality, right? So I, in the end of the today's live session, I just conclude that we have only 20 days in our hand to make our point for the National Pharmacy Commission Bill 2023. Dr. Juman Moda, I hope from you, I have a great hope from you, and you may take the initiative. Of course, Dr. Veera Sankar is available with his huge experience and unparalleled experience of this field, and other madam is also showing interest, Professor Asmita Vele, and the many more of us. Even you can have expert opinion of Dr. C.K. Katiyar and Dr. J.L.N. Sastri ji and all stalwarts of the field, what we have. Dr. Durga Prasad from the Dabar, Dr. Rajiv Rai, those who are working well and leading the Ayurvedic pharmaceutics. If I am quoting few 4 or 5 names, I never means that I am limited to these 4 or 5 names. The canvas is large. Anyone who is having interest and expertise, right from the, now I may go to the deep, Dr. Ashok from the Himalaya or the Dr. Rajiv Vasudevan, many more, whosoever, Mr. Ranjit Puranik. Yeah. So everyone, we have a share here. We may put our brain all together, and we must see whether this National Pharmacy Commission Bill 2023 is doing what to us, right? We have. And second, that is the clarification. And in this clarification, I welcome, but I request to the ministry, use the drug rules 1945, and connections must be there. The rule 157, 1B, rule 161, and rule 169. Thank you everyone. I do hope for a quick action for the National Pharmacy Commission Bill 2023. Thank you. अब तो कुछ नहीं हुआ मैडम प्रोड्यूस